is essential to have good posture while eating and drinking to assure the safety of the client. Benefits of proper positioning: maximizes eating independence, reduces the risk of aspiration and choking, facilitates digestion, promotes more effective swallowing, allows for more energy and effort during the mealtime process. Optimal positioning during mealtime: seated upright in the chair or wheelchair. Lock wheelchair brakes. Adjust the table height as necessary. Straight alignment with the shoulders over the hip. Head midline centered over the shoulders. Chin positioned slightly downward. Hips, knees, and ankles at 90 degrees. Pelvis stable. And feet apart, resting on the floor and or support foot plate on wheelchair. Positional challenges during mealtime: can interfere with the ability to eat or drink, requires following specific individual care plans, may be a result of muscle tone, difficulty coordinating movement, muscle weakness, ill health, altered conscious state, or other issues. May involve the use of specialized equipment. Types of equipment used for proper positioning during mealtime: a nosy cup, a plate with raised edges, and built-up utensils. These types of adaptive equipment will be described later in the video, along with additional types of adaptive equipment that can be utilized during mealtime. Signs and symptoms of choking and aspiration: difficulty breathing, frequent coughing, wheezing and gasping, blue discoloration, shortness of breath, reddening or tearing eyes. Diet modifications related to history of choking and aspiration and rapid eating pace. Cut the food into bite-sized pieces. 1 bite per swallow. Keep in upright position during meals. Keep in upright position after meals for 30 to 45 minutes. Avoid food that separates, such as rice or popcorn. Monitor for rapid food consumption with reminders to slow down, forcefully swallow, and clear the oral cavity. Encourage liquids between bites. Follow pureed diet guidelines if needed, such as grounding food up in a blender. Thicket consistencies. 3 of the most common consistencies. Number 1, honey. Less pourable, drizzle from a cup or a bowl. Number 2, nectar. Easily pourable, comparable to apricot nectar or thicker cream soup. Number 3, pudding. Holds its own shape, not pourable, and usually eaten with a spoon. Staff response to choking. Number 1, observe for gestures of the choking sign with the hands to the throat. Number 2, ask, are you choking? If yes, then let them know you are there to help.
Are you choking? I'm here to help.
Give thrust just above the belly button until the object is forced out, or if the person is making a breathing sound. Mealtime specialized equipment. Number 1, sippy cup. This is a cup with a lid and spout designed to keep the liquid from spilling. Number 2, a nosy cup. This is a cup with a cutout for the nose to make drinking easier. Number 3, lip plate. This is a deep inner plate that assists with one-handed feeding to minimize spills. Number 4, built-up spoon. This is a curved spoon with built-up handles that allow someone with limited hand strength and grip. There are also built-up knives and forks that can be used as well. Number 5, a high-sided plate. This is a slope plate, design plate with high sides and a wide rim to help push food into the utensil to prevent spillage over the sides. Number 6, divided plate. This is a high-sided dish design with section dividers with high sides for easy scooping and minimize spilling. And lastly, a Dyson map. This is a non-slip pad to stabilize equipment and allow the individual to scoop with less difficulty.
We went over good posture while eating and drinking. Some of the benefits of proper positioning include maximizing eating independence and reducing the risk of aspiration and choking. It is important to utilize optimal posture during mealtimes, such as remaining seated upright in the wheelchair and having straight alignment with the shoulders and hips. It is also important to address positional challenges during mealtime to learn how to better equip the client. It is important to be able to recognize some of the signs and symptoms associated with choking and aspiration, such as difficulty breathing, frequent coughing, and reddening or tearing eyes. There are diet modifications that can be related to the history of choking and aspiration and a rapid eating pace that must be considered. There are also thicket consistencies that need to be considered for clients. Lastly, it is important to make sure staff members know how to respond to choking to ensure the best safety for the client. And lastly, there are mealtime specialized equipment that can be utilized based on patient deficits and conditions.